Skull-based surgery, simply put, is surgery designed to address lesions or problems located in the skull base. Now, the skull base is a bit of a complicated area of our bodies. You can think of it a little bit like a cereal bowl, and the undersurface of the bowl, which supports the cereal, would be the skull base. It's kind of what supports the brain. It's generally made of bone, but there are little openings that allow blood vessels, nerves, soft tissue to communicate between the brain and the area below the brain. And that area with all that very vital traffic is called the base of the skull. And there's a portion of it, the front of the base of the skull and a part of the middle of the base of the skull, and sometimes even the back part that you can access through the nose. And that's really where my role in skull-based surgery has blossomed over the years, and certainly I give a lot of credit to Dr. Melvin Field, who's a neurosurgeon. He trained at the University of Pittsburgh, which is an area that really pioneered a lot of the surgical approaches to the skull base through the nose. It's a nice marriage between ENT and neurosurgery because we take the skills that we've learned and match them with the skills they've learned to be able to help our patients in some ways less invasive approaches to the skull base. There are pituitary tumors and other tumors that line the brain that we can access this way. In addition to pituitary tumors, we sometimes remove tumors, we sometimes will address spinal fluid leakage, which can occur in the skull base, benign tumors and malignant cancers as well. Once that is done, then the goal is to kind of rebuild the skull base, and we have techniques for doing that, for sort of putting a patch in. And so, generally speaking, we don't have a lot of packing in the nose when we're finished with that procedure, which adds to the patient comfort. It's not to say that there's, this is a fully non-invasive procedure. It is invasive to the back of the nose, but I think it is less invasive than the alternatives by a good long shot. And hopefully that equates to less time in the hospital and an easier recovery.